Okay. Hello, everyone. Welcome. This is Julie Smith, life and health coach, personal trainer, and I'm so excited that you've joined us this evening, or if you aren't with us live, that you're joining us later. We'll be sending out a recording of the call later. And so as you know, I'll be interviewing Laura Dankof this evening. And we're going to be learning about what functional medicine is, how this approach to healthcare is different, and why it's so powerful and effective. And I'm just going to read you a little bit about Laura before we bring her into a conversation. But Laura Dankof is a functional medicine nurse practitioner, speaker, and author of Seeds for Change, A Path to Health and Healing. Laura has over 25 years experience working in healthcare. She's the founder of pathtohealthandhealing.com and offers virtual and in-person consultations to help people heal their gut, balance their hormones, and reclaim their health and vitality. Laura has been a guest speaker at conferences and has spoken on topics related to natural and functional medicine. Her mission is to provide you with health information that empowers you to take charge of your own health and healing. Laura believes that health and healing is about addressing the whole person. This means addressing the physical, mental, emotional, and spiritual needs of the individual. She believes health is not simply about taking a pill. In her work, she has guided thousands of people over the years to identify the root cause or causes of their symptoms so they can begin to heal. She has seen how implementing a healthy lifestyle can lead to living a life of greater health and vitality, how addressing gut health and managing stress are key to wellness optimization. It is her hope today that she can plant the seeds of awareness in you as you discover your own path to health and healing. Laura wants you to have hope and a belief in how you have power to change your path to health and healing. Laura, I'm so excited to have you join us this evening. Thank you.
Thanks for having me, Julie. I'm really looking forward to this and sharing this very important information with people this evening.
Awesome. Thank you. And welcome to everyone who has joined us live. And so I just want to ask also that while we're on the call that you keep yourself on mute so that we don't have any background noise that can distract from the speaker in the interview this evening. So I appreciate that. Thank you. I think we have somebody who's not on mute. Let me see if I can take care of that. There we go. Awesome. All right, Laura, so can you tell us just a little bit about your story and what led you into the world of functional medicine?
Sure. Well, I've always been interested in natural health, integrative medicine. That was kind of an interest for me in my undergrad, but really kind of what drove my interest had to do with health crises with my daughter and even myself. So our youngest daughter was born with a blood disorder. It's genetic, and she was very ill the first 7-8 years of her life. Ultimately, she ended up having her gallbladder and her spleen removed at a very young age. And the treatment at the time after that was done was we were told she needed to be on antibiotics until she was the age of 21, and she was to take it every day and she wasn't supposed to stop it.
Wow.
So, which knowing what I know now is absolutely crazy and insane. And the guidelines had changed somewhere in that time as well. And the result of her being on antibiotics, about the age, I think 11 or 12, she developed a raging eczema, skin rash on her body. And it's just a light bulb, went off thinking, oh my gosh, she has yeast overgrowth. I mean, it was just instant kind of recognition. And so I sought out conventional health care. I was working as a nurse and took her into her provider and said, I think she's got yeast overgrowth on her skin from taking all these darn antibiotics. And they did a skin scraping and confirmed that. And she was put on topical steroids, which, knowing what I know now, that's just continuing to feed the problem.
Right.
And took her to a dermatologist who wanted to put her on an immunosuppressing drug. And I said, no way. And took some literature in and was dismissed, took her to her hematologist and was chastised in front of her and told that if I didn't put her back on those antibiotics, I was going to kill her in front of her. So I took matters into my own hands, and my sister-in-law was already seeing a natural provider in Colorado, where I now live, and talked to him, and they sent me some homeopathics, and I put her on the homeopathies. So that was my belief in homeopathy certainly grew out of that, and cleared up her skin, and we put the antibiotics in the cupboard. Needless to say, then she developed other things. She developed some food sensitivities, gluten sensitivity, all, I'm sure, the result of her microbiome, her gut bacteria being thrown totally out of whack. Right. And so she's very careful about what she does, but, I think that's something she's going to have to probably watch the rest of her life. And so that was the first time that I really wholeheartedly saw the failings within our conventional medical system. It's great with acute things, not so great with some of these modern day challenges in healthcare and so forth. Along with her issue, then, I was going to grad school under lots of stress, thought I was eating healthy, wasn't. I developed a thyroid issue because of that, and other hormonal issues, which then I had to try to figure out and correct, because I thought, if I can't figure this out for myself, how am I supposed to be telling my patients now that I was working as a nurse practitioner and had continued my education? And from that, I delved even further into natural medicine, and subsequently stumbled upon functional medicine about that time as well, and have learned everything I can about functional medicine, have taken numerous continuing education in that arena, numerous books. And that's probably true with most people that practice functional medicine, that we've all got a story, yes. That either happened to ourselves or a family member or a friend, where we saw where conventional healthcare just wasn't going to help us, and sought out to find answers. And I think that's true with anybody that kind of delves into this arena. And functional medicine really resonated with me because, the way that our healthcare system is set up is we do X, Y, and Z lab. And if all that comes back okay or shows something, then this is the medication you get for that. Right. It's not really delving deeper into figuring out what the root cause, and there's never just one root cause. There are various factors that kind of set up that perfect storm to get somebody to where they are, where they're seeking to find answers to their current health challenge. So that's where functional medicine, I think, really is going to be very key in the future. Cleveland Clinic, probably, I think about 3 years ago now, opened the first major functional medicine clinic in the country, and they cannot keep up. They've expanded, they're growing. Cleveland Clinic has taken this on and realizes that these out of control healthcare costs that we have and are going to bankrupt people and in the country, and we've got to start turning the tide around on these healthcare costs and realize there's more to health than a pharmaceutical, and we need to begin to figure that out. And that's where functional medicine, I think, is really placed in a good position for health into the future.
Yes. And I think Cleveland Clinic is really at the forefront of even, some cutting edge research and that kind of thing too, that they're able to take into that traditional medical system and say, look what we're doing, look how this is working, and to kind of begin to turn the, change the tide on that. So, yeah.
I think they, one of the things that they are seeking out is validating the outcomes and the benefits of taking a functional approach to care and having better outcomes with patients. And so more and more research is coming out supporting this approach to care, because, you know, try to get funding for research in things that aren't going to make somebody some money, you know, then that's hard for them to see the investment in the cost of research. Research is expensive and it takes a long time. Right. And there's a lot of anecdotal research out there, but now they're striving to get more solid validating research. But that, you know, proof is in the pudding, I say. You know, are we going to make people continue to suffer because of that? Or are we going to bring the art back into medicine that needs to be there as well? And that's a piece that has definitely been lost. Everything is so focused on, well, tell me the study that goes with that. Where's your research? Where's your study? Well, over here is this patient that's suffering.
Yes.
You know, we need to figure out what we're going to do to help them.
I love that you said that, you know, the art of medicine, right? Because it's not just set in stone, and everybody is different, and every person has a different story. So I love that you express that as it's not just a science, but it is an art, and you can't express that art. You can't get to the root cause of the issue and really help someone heal if you're not paying attention to the full story. And I think we'll find as we go on this evening that functional medicine is extremely empowering to the individual, because you have, as an individual, you have an impact and you have a choice, and you can impact the outcome of your health. So, and I think that's really critical in the epidemic of chronic illness that we're experiencing today.
Yeah, it is. And, you know, functional medicine is a true partnership between the patient and the practitioner. You know, it's not patriarchal, where I'm the provider and this is what I say goes. Right. You know, personally, I've just never been able to approach patients that way, because I'm thinking, they know more about their body than I do, and I need to listen, and then I need to bring in what I'm hearing along with my clinical knowledge and experience into that. But if I don't take that time to listen, we miss so much. I always say 90% of figuring out what's going on with somebody is listening, and our system isn't set up to take that much time to listen. And it's, you know, in functional medicine, you take people kind of on a journey. They may or may not realize it, you know, as I'm asking questions, because in functional medicine, we have what's called the functional matrix. And that's basically looking at what got them to where they are today on a timeline, going all the way back to the time they were born, or what went on with their parents, even when a person was pregnant. And so we're looking at genetics, we're looking at environment. What kind of stressors did you have in your life? Did you have any infections? Did you have any antibiotics? Did you travel outside the country? What was your diet like? So we're looking at all those things along a person's timeline to figure out what got them to where they are now, and when did those symptoms begin, and how long has it been going on, and what testing have you done. And your emotional health is a huge piece of this that we don't appreciate. If we're stressed out, or we're carrying around a lot of emotional baggage, trying to clear that and get past that can impede, your healing process. So that is something we touch on and should be a piece of that as well. So it's kind of like putting the pieces of a puzzle together, really.
Yes. Yes. And as I like to describe it too, especially when you talked about the perfect storm and a combination of different things. And usually by the time someone sees a functional practitioner, there's all kinds of things going on. So it's kind of like turning over the stones one at a time. It's not just one medicine. It's not just one interaction. There's usually going to be a number of different things or stones you turn over, a combination of those that are going to be the things that help you to begin to heal and feel better.
Right. And by the time someone usually comes to a functional practitioner, they've already had the conventional workup top to bottom. They've had everything done, and they'll either be given certain diagnosis and certain medications as a way to treat that, or we should say manage it. It's certainly not reversing or curing. Or they've been told there's nothing wrong with them.
That was my experience.
Uh-huh.
Right? You've got all these things going on, and you're told that you're just fine. The tests say you're normal, but you feel anything but normal.
Right. And that's where sometimes doing different types of functional testing can be helpful, along with just looking at that whole functional medicine matrix. So, there are different parameters with blood work when we look at blood work. So are the standard lab ranges. And if in conventional medicine, we're just taught, if you're in that range, everything's fine.
Right.
In functional medicine, there are the standard lab ranges, but there's optimal lab ranges. And you can't rely just on a lab. You have to take into consideration the person in front of you. And if there's not something there, then we start to look deeper, and maybe there's other blood work that we may do that you wouldn't normally do in a conventional protocol.
Right.
Or we might do functional diagnostic stool testing. I mean, this is very cutting edge, where they're now looking at DNA markers in the stool themselves for viruses and bacteria, parasites, etc. There's different types of hormone testing. So if you do standard blood testing for hormones, such like, for example, in women, if you're looking at estrogen, typically in a blood test, you're going to get one estrogen, an estradiol, and we have 3 major estrogens, and you're not going to see the free active hormone. You're kind of getting the unbound active and the bound inactive kind of clumped together, so you could have that hormone level look normal. So for many years, I've done saliva testing, which looks at the free level, which was what we had available. Well, probably in the last 5 years or so now, and more functional medicine practitioners are doing dry urine testing, because we can take things now even a step further there with the changes in testing and technology, and actually see how those hormones are breaking down into their final endpoint.
It's amazing.
And that can make a huge difference. You can do nutritional testing, organic acid testing. These are things, that insurance is likely not going to pay for. It's considered experimental, even though some of these tests have been around for, like saliva testing has been around for decades, and it's still considered experimental. And there's been who knows how many of those tests done, and different studies and so forth. So there's some really some cutting edge things there. You can do genetic testing. So there's a lot of different avenues to kind of try to solve the issue. But I would say, each functional practitioner has their own way of doing things, me included. So some practitioners may request that you do, $2,000 to $3,000 worth of testing even before they'll see you. Mm-hmm. And I understand what they're looking at, and they want to get the bigger picture. But sometimes if we can just kind of pinpoint what is a priority and start there, sometimes the other things will take care of themselves, because that's a huge investment for people. And, functional practitioners like myself or others, aren't going to take insurance because insurance companies don't like us.
Right.
And so they're not going to want to, pay for those kind of services, or they're going to fight it and so forth. Right. So, I'm very mindful of the investment. Your health is very important, and, it's definitely worth the investment, but I also want to be cognizant of what that entails for a person as well.
Right. Yeah. And I think it's important, a distinction there too, in all of what you said, is that when you go to a traditional medical doctor, they're going to run a very narrow scope of tests, right? Mm-hmm. And they're not necessarily going to get the big picture. So while you may not necessarily run $2,000 or $3,000 worth of tests like some functional practitioners might right off the bat, you still have at your disposal a much wider variety of testing that traditional physicians typically don't even look at. So that is able to, open up so many more avenues to explore as well. But another thing that I read today too, on that topic of affording and investment, and people thinking sometimes that functional medicine isn't affordable. If you consider the fact that you've heard the saying, if you keep doing the same things over and over and getting the same results, right? That's kind of insanity. It's the same thing with your health. If you're continuing to go the same route and adding more medications and more medications and more medications to treat more and more issues as they crop up, but not getting to the result that you want, not feeling better, you're just throwing good money after bad, and the investment is really not worth it anyway.
Right. And I would say, with testing in general, a couple of things, conventionally trained practitioners, they're not going to run a lab that they don't know what to do with. If they have not been trained in a particular type of testing, or how to interpret a particular type of lab, or what to do with that information once they have it, or understand the reason behind doing it, they're not going to do it. So in all fairness to them, the training isn't there. That's not what people were taught to do. So you really have to kind of have had some training in functional medicine or something to really understand that and appreciate that. And then I would also say that this day and age, people are paying really high insurance premiums.
Yes.
And oftentimes very high deductibles. Mm-hmm. So if you're requesting, I know that I had plenty of people requesting certain labs to be run under their insurance. And if their insurance doesn't cover it and you want it done, you're going to pay a premium price for that lab, where sometimes we can, if we get the insurance piece out of that, we can go to some discount labs and maybe get something that's more affordable to get that test for a person. And they can use health savings accounts and flex spending accounts. So if you're, considering working with a functional practitioner, when you sign up for your insurance plans, that's something you may really want to be thinking about doing, because that gives you a little more say and control in your own health care versus being locked into the mindset of, I can only do what the insurance company is going to cover.
Absolutely. It is a different mindset. It's, we've kind of been conditioned over the years to think that when I go see my doctor, whatever he or she says is what I need to do because they're the expert, and that's the thing to do. And we have sort of given up our power there. So what functional medicine enables you to do, and I think you said this earlier too, is to be a partner in your own health care. And so you take that power back, and that's part of that relationship that you have with your patients as a functional practitioner. It's a partnership.
Absolutely. I can guide and recommend all kinds of things to a person. Ultimately, I also, first and foremost, am going to want to know, what are your goals? What are you hoping to achieve? And what do you feel, where do you feel you can start with things? And then you're going to have to walk out and live that path, or not, or figure out how much of that you can or can't do. It's easy for me to guide and direct people, but it's another thing for the person to decide where they're going to go with that. And also, to be very clear that, it truly is a partnership. So I need to know, where are you at? Where's your mindset? What do you think you can do right now? Because I could spew out all kinds of things out of, my head of what to do, and try to, get it all there and get it all lined up and do all these things. But that's just too overwhelming. That's just too much. And so it's kind of like, where can we start?
Yes, exactly. And that's the thing with the labs too. I mean, there's so many things, so many small things that can have such a big impact that you can do even before you go down that road.
Mm-hmm.
Things that you can do that can make such a big difference. And, as you said, in terms of what is it that you can do and how do you walk that out? And I have to say, that's where your friendly health coach comes in.
Absolutely.
Because we partner together in making those things happen. And I think that's important to point out too, in terms of everyone that sees a functional medicine practitioner still has a traditional medical doctor.
Yes.
And that is, it's like building your healthcare team,
mm-hmm.
right? So could you maybe say a little bit about that?
Yeah, so I am definitely not going to be, I used to be people's primary care provider,
yes.
Until I recently moved to Colorado from Iowa. But I always want to make it clear that in the role that I'm at now, I am, and this is true with most functional practitioners, they are not going to be your primary care provider. They are going to be a part of your healthcare team, where you have your traditional primary care provider, go get your health screens, if you've got the flu or, whatever, that's where you're going to go to get that evaluated. It's where the functional practitioner comes into play. It can be a couple places. It might be someone's just wanting to be proactive to maintain good health, and they prefer to have certain health screenings done that traditionally would not get done, to make sure that they're staying on track and on top of things before a problem even arises. I would say the majority of people that find us are frustrated.
Mm-hmm.
They're frustrated and feel hopeless and helpless, that they are not being heard.
Yes.
They're not getting answers. They've had numerous testing done, and just feel like there's something missing.
Yes.
That and they need validation.
Mm-hmm.
And sometimes when you do these functional testing, that validation gets done. And a functional practitioner is your clinician, mm-hmm. your investigator, and then, a big part of this is always lifestyle.
Right.
And that's where health coaches are indispensable, to bring in the aspects of stepping you through those lifestyle factors and to keep you on track, and pick you up if you fall off.
Yes.
And that more intensive lifestyle changes that are, because I can say, okay, work on certain things with nutrition, or we do food elimination, but I'm then need to have that health coach that maybe is going to walk you through that process, or maybe is going, sometimes coaches will take you into the grocery store and say, let's look at these things and or what kind of meals can we plan because of all the food intolerances, or if we're trying to decrease inflammation, or whatever the case may be. You could even say part of your healthcare team may also be chiropractors and massage therapists, and psychotherapists, emotional freedom technique, and EMDR. These are other modalities that may need to be pulled into this whole healthcare team depending on your situation.
Right. And that goes back to that turning over stones again, right? To try to find that mix of things or interventions that are going to help you to heal. And that depends on you and your personal story and what you're dealing with in your unique body. And so, yeah, so many modalities and different things that we can pull in when using this holistic approach. And I love the idea of the team approach, the interdisciplinary approach of working together with the patient, to help that patient achieve their best health.
Right.
Absolutely. Yeah.
Definitely.
I wonder, just to kind of, and we talked about, functional medicine in a broad sense, but I kind of want to drive this home in terms of what specifically, it doesn't need to necessarily be a textbook definition, what functional medicine is, what are we doing with functional medicine, bottom line, that's different from the traditional approach?
Short and simple answer is functional medicine is looking for the root cause. Sometimes functional practitioners don't even want to know your diagnoses.
Right.
They're not looking for a diagnosis. They're looking for root cause and addressing root cause. And that means looking at lifestyle and genetics and stress and environmental exposures or toxins. So it's looking at all these root cause factors.
Right.
And so sometimes, like I said, they don't even want to know what your diagnosis is. What's your story? What are your symptoms? And then how do we figure out what's causing all of that to take place as far as how you're feeling currently and how you got there. So basically it means looking for the root cause.
Absolutely. Yes. Thank you. I just wanted to make sure we were really clear about that, because typically what happens in our traditional medical system is wonderful for that acute care piece, right? But yeah, it's that, but it's looking at symptoms. And once you have a symptom, we get a diagnosis, and then we get the proper medicine or the surgery or the whatever it is in order to fix it. Right. But it doesn't really fix it. It just masks it or helps or treats the symptoms. So that's the functional medicine. Like you said, to your point, we don't necessarily always care about what the diagnosis is. We want to find out what caused it to begin with. When we go after that, then we can really get some real healing going on.
Correct. And that's why I think it's just such an amazing thing, because I think that's the one thing, early on I was very frustrated with, working first as a nurse and then a nurse practitioner for so many years. It's just like, I'd have people come in and they would be on a dozen medications. I mean, that's not unusual. And so you start to think, well, what's all of that doing? The interaction between the medications and the body's biochemistry and so forth. And it's just like a losing battle. And, the economics of it as well, and the quality of life. And so, yeah, it's a very crazy situation.
Yes.
That we've gotten ourselves into. And I think in time, things will move the pendulum more. It's just going to take time and education.
So who do you typically see in your practice?
It varies, but I would say I see a lot of women with hormone-related issues, whether it's PMS, perimenopause, menopause, some with infertility. There's an alarming increase that I've noticed of women with infertility issues in their late 20s, early 30s. That's, I think the environment's definitely playing a role there. People with thyroid conditions, a lot of people with of digestive issues, irritable bowel, small intestinal bacteria overgrowth, food intolerances. Some people have, like chronic headaches and joint pain while they're, with any of these conditions. I always say the gut's the epicenter, no matter what it is, whether you're having digestive symptoms or not, everything starts there. Yes. Different autoimmune conditions. As well. I've done, worked with people with fibromyalgia and chronic fatigue. So quite a wide variety. But, my message on my website is heal your gut, balance your hormones, and reclaim your health and vitality. And the reason that is, no matter what, if you could have any one of these conditions or more than one, the gut health is key number one. And that in turn is going to affect your hormone balance. But sometimes you have to support the hormones so you have the energy to deal with the gut.
Right. Oh, yeah, for sure. Yeah. I mean, even from my own personal experience, I can say that, I felt like I was the poster child, right? For so many of those things that you listed out, right? But it came back to the health of my gut. And once I started to heal in that area, then some of these other things could start to heal as well.
Right.
Sure. So if I was a new potential new patient, or I signed up to come see you, what would that process look like?
The first thing you would do after you make an appointment, you would get an intake form that you would want to complete. And then I'm going to review that intake form to see what your family history is, what's your current problem, have you been exposed to any environmental toxins, what's your stress level, what's your diet like, all of those things are within that intake form. And then when you meet with me, I first want to know what is your goal, what is your health goal here, and then I want to hear your story, and I want to know what's going on that brought you here, when did these symptoms begin. Then I'm going to track that back even further, because sometimes we just don't even realize that things that happened so many years ago would have any bearing on what's happening to us today. Yes. And I would say, these can be things that happened in your childhood. Sometimes, if there's a huge stressor going on in a person's life that happened maybe 5 years before, it'll take sometimes 5 years before the symptoms start to manifest in a person.
Even like an emotional stressor.
Yeah, absolutely. Emotions, stresses, and emotions are key number one, because I could, go into how that lowers your immunity in your gut, which leads to a cascade of events to happen in the body. So I'm going to be listening and making mental notes along the way, and I'm starting to see a picture develop from that, and that in turn is going to help drive the direction that we go in that process. And it's going to be different for each individual. No two persons' plans are ever the same in functional medicine. In conventional care, we have, okay, you have diabetes, you get this medication in this order.
Right. Everybody gets the same protocol, right? That's not
more or less in this group of medications to pick from.
Right.
Functional medicine takes a lot more investigative work.
Yes.
A lot more behind what's that?
That's the art.
That's the art part, because
pulling it all together.
Yeah, because you have to take a broad view and then narrow it down with what's going on with the person and develop a very individualized protocol. So that's the behind the scenes time that you don't see that practitioner is spending, trying to put together a plan for you. And oftentimes, we may have some things that we may use off the off the top of our head, but more often than not, we are looking at multiple resources to make sure that, and different quality and purity of nutrition or supplements if that's needed, that to treat that person. So it's a very, very individualized approach. No one size fits all.
And that is incredible right there, that whole process. It's so unique from the typical experience. You know, when you go into a traditional medical office and where we're paying insurance, we get what, maybe 15 minutes? Maybe, right? That physician does not have the time, even if they wanted to, and many of them do, if they don't have the time to have that conversation with you that you just described. I've talked to numerous physicians who've said, I'm not able to practice medicine anymore in the way that I want, the way I thought I would when I decided I wanted to become a doctor.
Oh, that is so true.
Yeah.
So many are very frustrated with the whole system. It's a very broken system. They'll even say the system's broke, because when I was in the conventional healthcare setting, I would say to patients, I said, you and I are not the only ones in this room. We've got the government and the insurance company in here too, dictating what we can do and how much time we can spend. Now, I quite honestly broke that rule a lot.
You rebel, you.
I just, we were set up to have 20-minute appointments, and some people, we were double booking people behind on those.
You spent more than 20 minutes with me on more than one occasion.
Yeah. I would say, I'm going to need an hour with this person, or I'm going to need 40 minutes with this person. And I just quietly went about my business and didn't make waves about it, and got away with it, I guess.
Don't call attention to yourself, right?
Yeah.
Right. Yeah.
Because so much we miss in that short amount of time. And if you feel you're rushed when you're in that office, and you know that they've got many people behind you coming,
yes,
a lot of times you're not going to disclose everything that you need to disclose,
right?
Or you're going to walk out frustrated. Now some people, they'll come in with their list to make sure, I want this, and this answer today. And sometimes what patients will hear is, we don't have time for that. You get one complaint, one question, and you make another appointment.
Yeah.
Well, we're more complicated than that as people.
Absolutely.
So,
and you don't feel heard. You're not being heard.
Right.
And how many times do things, they either they get missed, or even sometimes, and I had this happen to me with my first pregnancy, where I was telling the physician something, and he said, no, that's not the way it is. The test said you didn't ovulate, right? So, and he instructed me to go home and start I was taking Clomid at the time in order to help facilitate the pregnancy. If I had done that, if I hadn't gone home and taken the pregnancy test, because I knew I ovulated, I went home, took a pregnancy test, and I was pregnant. If I had gone home and started taking that Clomid, what could have happened to my baby?
Right.
So that's just an example of, there's not the time. They're driven by the test, or they're driven by the time, or they're driven by the protocol or whatever, and not really listening. And I don't think it's necessarily that they don't care.
Right.
It's just they're kind of got their back up against the wall.
Absolutely.
Yeah.
Absolutely.
And that's what makes it so different in working with a functional practitioner, because that practitioner has the time to truly listen and to get the big picture, and is going to be putting in time outside of that session in finding the right the right approach for you. And I think that's just, incredible.
Yeah, it's definitely a different way of doing things. And I think one thing Cleveland Clinic is trying to figure out, and one of the things that they're trying to work through is how to make this system efficient. Because
Yes,
if you're seeing, one person an hour, how are you making that efficient from a business standpoint and feasible to keep your doors open? And that is where they are really relying on health coaches,
yes, right.
to help that with that process and that efficiency. And so they'll do a lot more group sessions there. Couple of times a week, maybe you come in for your group session.
Right.
Now, there's a lot of value that can be made in group sessions. Yes. I always kind of argue sometimes, that both have benefits, because when you're in a group of people, you see you're not the only one, right, and you learn from each other. But there's also a certain subset of people where they may not feel comfortable in that environment and ready to disclose. They may be more of the bystander listener,
right,
and may be afraid to ask certain things in that environment. So I think both need to be available.
And I would say too, as a health coach, because as a health coach, you're meeting with that client or patient more frequently, and you're having these sometimes in-depth conversations. And as a coach, I'm listening for things too that are possibly red flags, or maybe something that didn't show up on the original timeline, or that is pertinent to that client's health. And sometimes that maybe doesn't always occur to the client or the patient. And so if we're working together as a healthcare team, I can communicate that, help the patient to be able to know what to ask or to bring up to the physician, or even to communicate directly with the physician, him or herself. So
right, yeah. And so that's really important. And I think we need to see the value in that.
Absolutely.
As part of the team.
Yeah, absolutely. If this is a good time, I want to make sure that we can take a few questions from anyone who has those. There's a chat box for those of you who are listening. It's towards the bottom of your screen. If you click chat and open up that chat box, if you have any questions, feel free to type them in there, and then we will allow time for Laura to answer your questions. So,
yeah.
And
I would just say, too, if anybody is, wanting more information about what I do and so forth, or learning a little bit more about me, I'm just going to type in my website as well.
Perfect.
And they can go look there. And if they, I have a couple different gifts on the website. One is about food intolerances. There's one about hormones. There's one about detoxing. So, if they go there, they certainly can click on any of those and opt in to receive any of those gifts if they like. And that will include a educational series with that for them as well. So all of that's available at pathtohealthandhealing.com.
Mm-hmm. Oh, that's wonderful. Yeah, and it's also another way, it's wonderful that you offer that too, because then that also gives others a taste of a little bit of what you are like, and what your approach is, and how you think when they consume your content and your education. But you also have a Facebook group too, right?
Yeah, I could bring that up. It's Path to Health and Healing as the Facebook group, but with groups, they are like a bunch of numbers. So, or you can put in the search bar, but I will get the link here for you.
Yeah, you could search for Path to Health and Healing.
Yeah.
And then we'll also include the link when we send out the link to the call recording. We can put the link in there.
Yeah, here I've got it for you. But yeah, if you put that in the recording too, that will work. But there's the Facebook bookmark link. And you just go there and ask to join. And I'm always posting, information in there for people as well. There's my Path to Health and Healing business page, which I don't post I post more within the group.
Yes.
Than I do on the business page and that's a good place to even ask questions, as well. And I encourage that, if people have questions, somebody else has that question and may be wondering about things as well. Yeah. And so I would encourage that within that group because it would be a good learning experience for everyone.
Yeah, that's the nice thing about groups. It's much easier to interact and engage with one another within the group. So I see that you put the link to your Facebook group there as well. Thank you.
Mm-hmm. Yeah.
Do we have any questions at all? Don't be shy. We would love to answer any questions that you have.
And certainly, if somebody's listening to this later, and they do have a question, they can either, contact me through my website or join the Facebook group and post it there. Or if there's something that you think would be helpful to the group, post that in there as well.
So if I know that I want to make an appointment with you, how do I do that?
So you just go to pathtohealthandhealing.com and you click on the schedule button. And that starts the process, and then I'll get notification of your appointment. And if it's first time scheduling, then I'll be sending you out your intake forms and your consents and so forth. And the nice thing is, we can do appointments just like this. It uses Zoom in a HIPAA compliant portal to do the appointment. So we would be doing FaceTime. Unless somebody doesn't want to do FaceTime, then we can certainly do by phone. I've had to do that a few times as well. So either way is fine.
Right. Yeah, it is. Technology is wonderful. I do meet with clients frequently using Zoom, and it's a great way. It's just almost like being in the same room, right?
Yeah. Right. Yeah.
Sure. And it is HIPAA compliant, so it's completely it's private.
Right.
Yeah.
Yeah, it works very slick. So.
Yeah. Well, Laura, is there anything else that you want to share with us this evening? You've just been very educational and so informative. I appreciate it so much.
Well, I just want to, thank you, Julie, for having me on here this evening. I appreciate that. And I just want to say, don't lose hope. There's always someone there to help you to try to solve your mystery illness, if you will, in some way. And I think functional medicine is a great place to start, provided you've had your conventional workup done, that we're not missing anything big and major that does need that approach. Right. But when all of those things have failed to get you the answers that you need, and you're feeling not heard, you're frustrated, then that's probably the time to maybe seek out a functional medicine practitioner to see if they can help you figure things out. I will tell you, all functional practitioners that I know of are very passionate about what they do. And they really care, and they are going to be just as frustrated if they can't figure it out, or recommend, another source to you if they're, hitting a wall with something, but they're going to do their darndest to try to figure it out.
I agree wholeheartedly. I mean, I love hanging out with my functional practitioner friends. They, you're absolutely right. You won't find professionals who are more caring and more sincere about their efforts in helping their patients. When you think about that, these are individuals who have given up the security of the traditional medical system, who have, given that up, that backing of insurance, and gone out there on a limb, typically, to open their practice and do this. They're doing this because of the love and the passion that they have for helping to heal their patients. They're not doing it because they're out there, making a big buck and driving their expensive cars or anything like that. They're doing that because this is what they feel called to do, and helping their patients heal.
Yeah, and I will just say, James Maskell, he started the Functional Forum. He's a lay person, but he saw the value in functional medicine and the broken healthcare system several years ago. And he is really, I say, a huge driver in the movement for functional medicine. And I think one of the things that he and Sachin Patel and others are concerned about is there are many functional practitioners that have taken that risk and gone out on a limb to try to move out of the traditional healthcare system and try to be out there to help people. And a lot of them don't make it financially to continue. And yet this is a service that we need, and is only are we going to continue to need moving into the future. There are not enough functional practitioners out there now, and it's sad when so many have to give it up for financial reasons, because they're just, they aren't being seen or able to make a living at it. It's not an easy thing to do. Right. But they do try because, just like me, we try because we know there's a need and we want to help people. And it saddens us to hear all the stories that we hear, and the frustrations and the hopelessness that people have, and feeling that they just don't know where to turn and don't have answers. And so that's what drives us. So.
Yeah. And I want to say, this is just about change. I want to make sure that we're very clear that we're not bashing the traditional medical system. Mm-hmm. It is incredible what we can do in terms of acute care.
Absolutely. It's saved many people in my family's life.
Absolutely. And if I have a broken leg, if I have a heart attack, if I have a stroke, if I have, an aneurysm, if I get into a car accident, take me to the emergency room, right? That's Absolutely. Where I need to be.
Don't come to a functional practitioner.
No. So what we're talking about here is really the chronic issues that are happening to individuals. Those, the autoimmune conditions, even cancer and dementia and diabetes and heart disease and all of those things that haven't gotten to an acute stage, right? These are chronic issues that we're dealing with, and our current healthcare system, the way it's set up, isn't set up to be able to handle and manage the chronic care. And that's what's costing the government and the citizens so much money, is just trying to manage this chronic care. And so that's what we're talking about here, is just change. How can we change the healthcare system and make it better? And that's what functional medicine practitioners and integrative practitioners are attempting to do. And places like the Cleveland Clinic is just to try to help move the dial and change the system and make it better.
Absolutely. We need both, and we're never not going to need both.
Right.
And, we could go into for another day of why we're seeing such an epidemic of all kinds of chronic health issues and happening to people at younger ages. But that is just increasing awareness. And I think we'll continue to do that, and how we can be the masters of our own health.
I love that. Masters of our own health. Yes. Well, Laura, we are at the top of the hour, and I just want to thank you so much for being with us on the call tonight. And I just want to reiterate to everyone that I'll be sending out probably tomorrow a link to the call recording so that you can listen to that again. And if you have any questions at all, reach out to Laura. Go pop in her Facebook group, and I know she's there, and she's active in that group frequently. But thank you again, Laura, and thanks all of you for being here too.
Okay, thanks for having me, Julie.
All right. Good night, everyone.
Night.